Hello everybody. Today I'll talk about the last part of the muscular system. First, I'll talk about the muscles act on the shoulder joint. Always remember that the muscles cross the joint from above, work on the body part below them. So those muscles cross the joint below them would work on that joint or the part below them. So the muscles that work on the shoulder joint includes the sternocleidomastoid, that muscle. Here is the shoulder joint. So sternocleidomastoid is the muscle, comes from above and gets attached to the clavicle and sternum. Okay, and this muscle, sternocleidomastoid, pulls the clavicle and the sternum upwards. Okay, and you know that the lateral end of the clavicle is attached to the scapula. So when you move the clavicle upwards, the scapula moves up, right? And that moves the whole shoulder upwards. Scapula is the shoulder blade, and this is the acromioclavicular joint. So the clavicle gets attached to the scapula. So when this muscle lifts the clavicle, that also lifts the scapula upwards. Okay. Deltoid is the muscle located in the upper and lateral part of the arm. This muscle is used for intramuscular injection, pretty commonly used for intramuscular injection. And this muscle, since it is attached to the lateral side of the arm, always remember that muscle moves the part towards them. So like this muscle sternocleidomastoid will move upwards, right, towards it. Since the deltoid is the lateral muscle, it will move laterally. That is called the abduction of the arm. Make sense? So towards it. This muscle, pectoralis major, is a large muscle in the chest. Pectoralis means chest, major is the main one. And since it is going from the chest to the arm, it will pull towards it. That is adduction. Make sense? The main action is adduction, and abduction is away, moving away. Adduction is moving towards the body. Okay. Now, if you remove the pectoralis major, under the pectoralis major there is a similar muscle but much smaller in size, and this one is called the pectoralis minor. Okay, under the pectoralis major, and they work on the shoulder joint. Okay, and these are the muscles in the front. And I have already talked about the serratus anterior attached to the ribs. Now let's go to see the muscles in the back. This muscle is trapezius. In the left side, in this side, you can see the superficial muscles, and in this side you see the deep muscles. So in this side they have removed the outer layer or outer muscles. So let's first see the superficial muscles. The largest muscle in the back is the trapezius. It is a kite shaped muscle. You see one half in this side, similar half in the other side, but in this side they have removed it. So it is a large kite-shaped muscle in the back. Upper end is in the back of the neck here, and this muscle acts on the shoulder. Okay, trapezius. Then I already showed you deltoid in last slide, right? Now below the trapezius, in the lower part of the back of the trunk, you have this big muscle. This is called latissimus dorsi. So trapezius is above. It is a kite-shaped big muscle, and this one is below. This is also a big muscle, and it is called the latissimus dorsi back. And you see it goes to the humerus. So it acts on the shoulder joint. And now if you remove the trapezius, you will see the muscles under the trapezius. This one coming from above and getting attached to the scapula, shoulder blade, this is called levator scapulae. Makes sense? It will lift the scapula since the muscle moves towards it. Muscle moves the structure or body part or bone towards it, right? So this muscle is coming from above, so it will move it upwards, move the scapula up. So that's why it is called levator scapulae. Okay, and then you have two rhomboid shaped muscles under the trapezius. This one is called the rhomboid minor, the smaller one, and this one is rhomboid major, also called rhomboideus minor, rhomboideus major. So those are three muscles in the medial side. Now here you see this is the spine of the scapula. You must remember in the back of the scapula you have a spine, and above the spine this muscle is called supraspinatus. Makes sense? Supra means above the spine, and below the spine this one is infraspinatus. Okay, so infra means below and supra means above the spine, and then below the infraspinatus you have the teres minor and teres major. So four muscles here: supraspinatus, infraspinatus, teres minor, teres major. And in the medial side you have levator scapulae and two rhomboid, rhomboid minor, rhomboid major. So those are under the trapezius. Okay, and now we'll see the muscles of the upper and lower limbs. First we'll see the muscles of the upper limb. Upper limb has arm, right, forearm and your hand. So first we'll see the muscles of the arm. This is the back of the arm, and in the back of the arm you have this large muscle. This is called the triceps brachii. Why it is called triceps? Because it has three heads: lateral head, long head, and there is another head you don't see here, that is the medial head. Medial head. Okay, so three heads. Uh, that's why it is called the triceps. It is called brachii because arm is the brachial part, so most of the muscles of your arm has brachii in its name. So triceps brachii is the main muscle in the back of the arm, and since it is in the arm, it will work on the bone below it, right? So which bones are below it? The radius and ulna. That means your forearm. So it will work on the forearm and will move the forearm backwards. That means extension. Make the forearm straight, extension. Okay. So two things are important. The muscles above will work on the bones below and will move the bone towards them. Okay. Now, in the back of the elbow joint, there is another small muscle. This one is small, and this is called anconeus. Okay, it is a synergist, helps the triceps. Just put additional uh, force and stabilize the joint. Okay, so those are two in the back. The big one is triceps brachii, and the small one here is anconeus. Four muscles form a rotator cuff. What is rotator cuff? You know, the scapula has the glenoid cavity. You remember that? And the glenoid cavity is shallow. I told you before. And this is the head of the humerus, the arm bone. Okay, head of the humerus. Since the glenoid cavity is very shallow, what happens? These four muscles, their tendons get attached to the edge of the glenoid cavity and makes the glenoid cavity a little bit deep. Like this is the glenoid cavity, shallow. So the tendons come from the muscles around those four muscles and get attached to the around the glenoid cavity. Okay, to hold the head of the humerus strongly, to provide support, and this is called the rotator cuff, formed by the tendon of these four muscles. Okay, so remember, these are rotator cuff muscles. So this is the front of the arm. So first we will see the main muscle. The outer one is called the biceps brachii. Why it is called biceps? Because it has two heads, bi. Okay, so you remember in the back, the main one is triceps brachii. In the front, this is the biceps brachii. Okay, the prime mover, the main muscle for the flexion of the forearm. This one will work since this is uh, a, a muscle in the arm. It will work on the forearm below it, right? And will move the forearm towards it. That means it will cause the flexion of the forearm. Okay. And under the biceps, there is another big muscle that is called brachialis. You see, all names have brachii or brachii. So, triceps brachii in the back, biceps brachii in the front, and under the biceps brachii, you have another big one that is brachialis, right? So, all have brachii. The reason is this is the brachial part, the arm part, right? And another muscle that starts from the arm and goes to the radial side of the forearm. That's why that is called brachioradialis. So it makes sense, right? Starting in the brachial part and going to the radius of the forearm. That's why it is called brachioradialis. So those are three muscles you see in the front of the arm. Okay. However, the brachioradialis, a large part of it is in the forearm. Okay, so the forearm muscles are located in two compartments. Anterior of your forearm is called the flexor compartment or anterior compartment, the front of the forearm. flexor or anterior compartment. Okay, and why anterior compartment muscles are flexors? Because the anterior forearm muscles will work on which part? The part below the forearm. That means will work on hand and the fingers. Those are the structures below the forearm, right? And the front muscles will cause the flexion of the hand and flexion of the fingers. Some muscles end on the hand and they will work on the wrist joint to move the hand. Some muscles go all the way to the fingers, digits, so they will cause the flexion of the digits or fingers. Okay, so flexion of the hand, flexion of the fingers. Those are the actions of anterior forearm muscles, and all these are flexors. That's why most of them are named after the action. Okay, so in the radial side of the forearm, that means the lateral side is the radial side, you have flexor carpi radialis. Then palmaris longus, flexor carpi ulnaris in the ulnar side. So if I ask you flexor carpi ulnaris, when I will say flexor, you will look in the front of the forearm, not in the back, right? Back muscles are extensors. If I say extensor, you will look the posterior of the forearm. If I say flexor, you will look at the anterior. Okay, so very simple. And if I say ulnaris, you will look the ulnar side, that means the medial side. If I say radialis, that means the radial side or thumb side, lateral side. Now just think that if I say flexor carpi radialis, so flexor means front of the forearm here, and radialis the lateral or radial side. If I say flexor carpi ulnaris, you will look the front of the forearm and ulnar side. If I say extensor, you look in the back. Flexor digitorum. This muscle goes all the way to the digits. That's why called digitorum, fingers, and will cause the flexion of the fingers. There are two. One is superficialis, that's the outer one, and profundus is the inner one. Okay, and both are responsible for the flexion of the digits or fingers. Then flexor pollicis longus. So this one will go to the pollis, means thumb. So it will work on the thumb and will cause the flexion of the thumb. So you see, all these names make sense. So if you just think, it will be easy for you to identify. If you see the tendon, end of the muscle is going to the pollis, that means thumb, from the front, that is flexor pollicis. Okay. If you see the ends are going to the digits, the fingers, other fingers, all fingers, flexor digitorum. Only to the thumb, flexor pollicis. Okay, going to the palm, ending there, that is palmaris longus. Okay, so now let's see. This is the front or anterior compartment or flexor compartment of the forearm. So this is the thumb side, that means radial side. Remember, that's the lateral side. So first, you remember I said that one muscle comes from the arm, brachioradialis, arises in the arm and goes to the radial side of the forearm. That's why you see brachioradialis here, okay, in the radial side. Then you have flexor carpi radialis. Then you have palmaris longus in the middle. Why it is called palmaris longus? You see, it is going to the palm, ending there. Okay, that's why it is called palmaris longus. And this is flexor carpi ulnaris. This is the ulnar side, the pinky side, and this is in the front. That's why flexor. Okay, so flexor carpi ulnaris, flexor carpi radialis, and in between palmaris longus. Okay. Now, those are the superficial muscles. Now, if you remove those muscles, you will be able to see the deep muscles under them. So, what are the deep muscles? This is a big one. Flexor digitorum profundus. You remember I said digitorum, that means the end of the muscle will go to the digits. Okay, so let's see flexor digitorum profundus. This one, you see the end forms tendons, and those tendons are going to the digits. So if I ask you which muscle is this, of course flexor digitorum. Now there are two. Remember, one is called superficialis and another is profundus. This is the deep one. Superficial one is in last picture here, flexor digitorum superficialis. This one underneath here. Okay. And this muscle also goes to the digits or fingers. So two digitorum, superficialis and profundus in the flexor compartment. And flexor pollicis longus, you remember I told you this muscle only goes to the thumb like this. You see the tendon, the white structure, the tendon is going here. Okay, so this is flexor pollicis longus. Okay, in the back of the forearm you have the extensor muscles. Most of them start with extensor carpi radialis in the radial side, but in the back of the forearm, right? That's why extensor. There are two, longus and brevis. Longus is the long, brevis is the short. Extensor digitorum will go to the digits, but from the back, okay, will cause the extension of the digits. That's why called extensor digitorum. Extensor carpi ulnaris in the ulnar side, okay. Extensor pollicis will go to the pollis, the back of the thumb. There are two, brevis short and longus long. Extensor indicis. This one, you don't have any muscle in the flexor compartment that only goes to the index finger. However, in the back, there is one that is called the extensor indicis, and the tendon goes to, this muscle goes to the back of the index finger. So when you want to point something with your finger, you extend your index finger, and that is helped by the extensor indicis. You make the index finger extended or straight. And this one, abductor pollicis longus. Pollicis, that means it will go to the thumb. However, we'll do what? We'll do the abduction, move the thumb away from your hand, okay, laterally. So there are three pollicis. Flexor pollicis will cause the flexion of the thumb. Extensor pollicis will cause the extension of the thumb, and the abductor pollicis will do the abduction of the thumb. So these are the muscles in the posterior compartment or extensor compartment of the forearm. Here, let's see, the start from the radial side. Extensor carpi radialis. There are two, right? One is the longus, another is the brevis. Okay, long and short ones. So these two. Then this is radial side, remember, thumb side, and this is the back of the forearm. Extensor digitorum. You see very clearly the tendons from this muscle are going to the back of the fingers. So will cause the extension of the fingers or digits. Okay. Uh, Extensor carpi ulnaris in the pinky side, ulnar side, in the back of the forearm. That's why extensor ulnaris. Okay. So those are the superficial muscles here. And then you see extensor pollicis longus and brevis. This is the longus and this is the brevis. And they will go to the thumb, back of the thumb, to make the thumb extension of the thumb. That's why extensor pollicis, long and short. Okay. And then abductor pollicis is another one. Here, if you remove those superficial muscles, you can see here more clearly. Again, extensor pollicis longus. Why it is longest? You see this one is long, this one is short, brevis. Both go to the back of the thumb, the tendon. And this one, you remember I said extensor indicis. When you point something, you extend your index finger. So this one is only going to the index finger, back of the index finger, and we'll pull the index finger from the back. Okay. And there is a muscle in the back of the upper part of the forearm that is called supinator, and above that, in the back of the elbow, you have the anconeus. Anconeus I showed you before. Here you can see the supinator causes supination of your hand and forearm. Okay, now I'll see the muscles of your hand. In between the metacarpal bones, these are the bones of your palm hand, and in between the metacarpals you have the interossi. Interossi muscles, inter means in between, ossi means bone, osseous. So in between the bones, and they are originated from the metacarpal bones, and the tendons get attached to the digits or phalanges. So they move the fingers. However, these muscles are small muscles and they help in fine movement. You know, the flexion, extension, those are helped by the forearm muscles, the flexors and extensors. However, interosseous muscles help in the fine movement like painting, drawing, those kind of movements. Okay. And in the back of the hand, you have also interossi, but these are called dorsal interossi. Okay. This is the front of the hand, anterior. So palmar side, palmar interossi, and in the back of your hand, you have dorsal interossi. Okay. So two group of interossi. Now we'll talk about the muscles of the lower limb. Lower limb muscles are the muscles that work on the hip joint, muscles that work on the knee joint, and the muscles work on the ankle and the foot. So first we'll see the muscles of the front of the lower limb. So this is your thigh, you can see that, and those muscles come from above. They work on the hip joint. In the front, there is a muscle come from the ilium of the hip bone. You remember the upper part of the hip bone is called the ilium, Hip bone has three parts: ilium, ischium, pubis. Ilium is the upper part. So this muscle is called iliopsoas. This one, this whole thing, iliopsoas, because it comes from the ilium of the hip bone, okay, and goes down to work on the femur. So iliopsoas. Iliopsoas is actually formed by two muscles, psoas major and iliacus. So it is a muscle coming from above, crossing the hip joint uh, from the front. Then you see this muscle. This is a long muscle, crosses from the lateral side through the front of the thigh to the medial side. So it crosses the thigh from lateral side to the medial side, and this is called the sartorius talar muscle. And then this is a muscle, huge muscle in the front of your thigh, the middle of the front of your thigh, the main one, that is called the rectus femoris. Femoris because this is the femoral part, only bone is the femur here. Rectus means straight, so rectus femoris. Then there are three vasti: vastus lateralis, vastus medialis, and there is another one called vastus intermedius. And this is the lateral side, right, of your thigh. So this is vastus lateralis, this is vastus medialis, and intermedius is under the rectus femoris, in between lateralis and medialis. Okay, so those four muscles together is called the quadriceps femoris muscle. Which four muscles? Rectus femoris, three vasti: vastus lateralis, vastus medialis, and vastus intermedius. Make sense? So three vasti and rectus femoris together form the quadriceps femoris. And from the quadriceps muscles, a tendon goes down to get attached to the patella, and that is called the tendon of quadriceps femoris. Make sense? And then from the patella, a ligament goes down to get attached to the tibial tuberosity. This is called the patellar ligament. So patellar ligament is here. So above the patella, tendon, quadriceps tendon, and below the patella, patellar ligament. Why this one is tendon, this one is ligament, although structurally they are same. This is tendon because tendon attaches the muscle to the bone. So you see, from muscle to the bone, and ligament attaches bone to bone. So patella to the tibia. That's why this part is called the patellar ligament. We tap on the patellar ligament to see the knee jerk or reflex. Make sense? So you see in the front, quadriceps group of muscles, or those four muscles of quadriceps group are the main muscles. However, you have sartorius that crosses the thigh, right? And in the very upper part, you have the iliopsoas. And in the medial side, you have adductors. Adductor muscle causes the adduction, moves, adductor muscle moves towards the body, okay, medially, because they are located in this side and they will move towards them. Make sense? So adductor longus, adductor magnus, and then gracilis is also in the medial aspect of the thigh. So those muscles do what? Do adduction, move towards them. Okay. There is another muscle in the lateral side that is called the tensor fascia latae, and from the lower end of tensor fascia latae gets attached to this white structure that is called iliotibial tract. Okay, and iliotibial tract sometimes can cause pain, that is called runner's leg. In athletes, you see the iliotibial tract is located lateral of the thigh, and in athletes, when these, due to exercise, when these muscles grow, get bigger, fat, then what happens? Pressure increased on this iliotibial tract, and that can cause pain. In the back of the thigh, you have hamstring muscles. Three muscles are called the hamstring muscles in the back of the thigh: biceps femoris, semitendinosus, semimembranosus. Okay, so we'll see those three muscles first. You see, this is the lateral side, right? So this muscle is called the biceps femoris. Why biceps? It has two heads, okay, long head and short head. And not biceps brachii. Brachii, if you hear, it is in the arm, right? Femoris in the leg. So biceps femoris is the lateral, and medial one is semitendinosus, and under semitendinosus you have semimembranosus. So those three muscles together called the hamstring muscles. Two semitendinosus, semimembranosus medially, and the biceps femoris laterally. Okay. Now, in the very upper part of your thigh, in the buttock area, you have a huge muscle, that is the outer one, called gluteus maximus. Maximus means the largest one. Then under the gluteus maximus, you have the gluteus medius. These two muscles both are used for intramuscular injection too. And under the medius, you have the smaller one, that is the gluteus minimus. Okay, so three gluteus. Gluteal muscles, since they are in the back, so they will cause the extension of the thigh. That means backward movement of the thigh, as well as you see the gluteus gets attached to the side of the thigh, so it will cause lateral rotation. Also gluteus goes to the medial side of the femur, so it causes a number of movement: extension of the thigh, rotation, lateral and medial rotation, as well as abduction of the thigh. uh, Adductors, as I mentioned, the muscles in the medial aspect of the thigh cause the adduction. So most of them start with adductor, adductor magnus, adductor longus, adductor brevis, and then you have two other muscles cause the adduction: pectineus and gracilis. Here you can see, if you remove some superficial muscles, this is actually the origin of pectineus. This is adductor magnus, this whole thing, and this is adductor longus. Okay, and this is adductor brevis. So adductor magnus, adductor longus, adductor brevis all start with adductor, and two other muscles just cause also adduction. One is this one, pectineus, and another is gracilis. Okay, so those are the adductors. here the back of the upper part of the thigh, so you can see the gluteus maximus, gluteus medius, gluteus minimus, three muscles. Bigger one, the largest one, medium sized, smallest. Okay, all of them get attached to the femur. Muscles of your leg. The front of your leg, you have just couple of muscles. The main one is in front of the tibia. That's why it is called the tibialis anterior. This one makes sense by location, right? And also you have the extensor digitorum longus. You remember, uh, you should remember that the muscles go to the foot from the front of the leg. They will do what? Will move towards them. Will move the fingers and foot towards them. That means extension of the digits, okay, and dorsiflexion of the foot. So anyway, here tibialis anterior in the front of the tibia, and this one is extensor digitorum. That means the lower end, the tendons will go to the digits. You can see here they are going to the digits and will pull towards it. That means will cause the extension. Extensor hallucis longus. Pollice means thumb, hallus indicates the big toe, remember. So extensor hallucis will go to the big toe. Okay. Extensor hallucis longus, there is extensor hallucis brevis. Tendons, both of those tendons, this one and this one, will go to the big toe. Okay. This is the lateral side of your leg. So this is the main muscle in the lateral side of the leg. You know, lateral bone is the fibula, so this is the fibularis longus. Okay, and then you can see anterior muscles too. Tibialis anterior, extensor digitorum longus. We have already talked about those. Extensor hallucis, right? Now let's see the back. The main bulk of the back is formed by the gastrocnemius. It has two heads, lateral and medial. So this is the outer one in the back of your leg, and that is the big one, gastrocnemius. From the lower end of this muscle, you see this large tendon go to the heel bone, calcaneus. So that's why this is called tendocalcaneus or tendoachilis, Achilles tendon. Okay, this one from the gastrocnemius to the calcaneus. That's why it is called tendocalcaneus or tendoachilis. Now, under the gastrocnemius or gastrocnemius, you have another big muscle. This one, this is called soleus. Okay, so those are two big muscles in the back. And then under the soleus, you have tibialis posterior, the back of the tibia. Okay, so the back of the leg muscles will go to the foot, to the bottom of the foot and bottom of the toes. So they will do what? The plantar flexion of the foot and flexion of the toes. The front muscles of the leg will go to the foot to cause the dorsiflexion of the foot and extension of the toes. So you see the back of the leg. These are two heads of gastrocnemius, tendocalcaneus or tendoachilis or calcaneal tendon goes to the calcaneus. And then if you remove these, you will see the soleus. This is soleus, another big muscle, Now if you remove the soleus, then you will see the back of the tibia. Tibialis posterior. Make sense? So in front of the tibia you have tibialis anterior. The back of the tibia you have tibialis posterior. Okay. And another muscle, of course, flexor, hallucis longus. This muscle goes to the hallux, that means the big toe, from the bottom, and flexor digitorum longus will go to the toes, all the toes. Okay, so flexor digitorum longus and flexor hallucis longus. So the back of the leg muscles are flexors, front of the leg muscles are extensors of the digits, that means of the toes. Okay, so those are the muscles of your leg. Okay, so in this section we talked about the muscles of your arm, forearm, hand, muscles of your thigh and the leg, that means upper